This is a WECT Cape Fear Business Break.
Hello, I'm Megan Donahue. Dr. George Huffman is a neurosurgeon with us today from Atlantic Neurosurgical and Spine Specialists. Dr. Huffman, welcome back.
Megan, thanks for having me back.
I understand that as a neurosurgeon, you primarily operate on the brain and perform complex spine surgeries. I would assume that there's sometimes patients that continue to have pain and problems even after surgery.
That's right, Megan. Sometimes we can fix the anatomical problem and it doesn't necessarily make the patient's pain or symptoms better. So you've made the picture pretty, but you haven't necessarily fixed the patient. There's also those patients that may have severe pain and symptoms, but there's not an anatomic problem for us to correct surgically.
Okay, well, I know pain is a concern for most people. I'm sure there's curious viewers out there that would like to know, is there anything that can be done for chronic pain?
Well, what we typically do is try to get those patients set up for some sort of conservative management. Injections, physical therapy, acupuncture, chiropractic, anything that involves non-surgical options. But for those patients that doesn't work for, there may be another option. There's something called a spinal cord stimulator. It's sort of like a pacemaker for your nerves. What we do is we go in and we put these wires up along the spinal cord, and it helps to interrupt the transmission of pain signals from your back and legs up to your brain. It doesn't always work, but for those patients that have chronic pain after a failed surgical procedure or who don't have an anatomic problem we can correct, it may be the best option for them.
That's great. It's glad to know that there's options for those folks who've suffered from chronic pain. Thanks. For more information, go to atlanticneurosurgery.com.
For more details, go to Health First on WECT.com.